Someone cut off a child's leg 31,000 years ago with a stone tool, not in a hospital, not in any world we would recognize as medicine. The bones were found deep inside a cave in Borneo, belonging to a child who lived before writing, before farming, before metal, before almost everything we usually associate with civilization. And the most disturbing part is not simply that the leg was removed, it is that the cut was deliberate. The tibia and fibula were severed with enough control that archaeologists do not believe this was an animal attack, an accident, or a crude act of violence. Someone did this intentionally, which leaves a question that should feel almost impossible. Was this the oldest surgery ever discovered? To answer that, we have to move forward before we can move backward. Through skulls opened with stone tools, surgeons who learned across generations, physicians who wrote down injuries they could diagnose but could not cure, and ancient doctors who rebuilt faces and restored sight without understanding the body in any modern sense. Because by the time we return to that child in the cave, the question will no longer be only whether surgery existed before civilization. The question will be what kind of human world had to exist for someone to survive it. In 1996, archaeologists working at a Neolithic burial ground in Ensisheim, in the Alsace region of eastern France, opened a grave that had been sealed for nearly 7,000 years. Inside was the well-preserved skeleton of a man who had died around the age of 50. He had been buried with care, an arrowhead and a stone adze laid beside him. He died sometime between 5,100 and 4,900 BCE. He lived before writing, long before metal tools became common in Western Europe, before the rise of cities. He belonged to one of the early farming communities spreading slowly across Neolithic Europe, people clearing forests, planting grain, and building from timber and stone. By almost every standard we use to define civilization, this man lived near the beginning of it. And yet, someone had cut into his skull. His skull had two openings, one at the front above the forehead, and a second, larger one set higher up at the crown of the head. The edges of both were smooth and controlled, too clean to be violence, too deliberate to be an accident. And both carried the same crucial sign. New bone had formed around their margins. He had not died during the procedure, but they had not healed to the same degree. The smaller opening at the front, roughly 2.6 by 2.4 inches, had closed almost entirely, the bone remodeling over what must have been years of life. The larger one at the crown, about 3.7 by 3.6 inches, had only partially sealed, most likely because the opening was simply too big to ever fully close. That detail is everything. It means he did not just survive a single operation. He survived the first, lived long enough for the wound to grow over, and then went through it a second time. When researchers from Freiburg University published the find in 1997, they described it as the earliest unmistakable evidence of healed cranial surgery yet known. Even today, surgery on the skull is among the most demanding procedures in medicine. 7,000 years ago, someone performed it with a stone, and the tool was not as crude as it sounds. A freshly struck flint edge is sharper than a modern steel scalpel. But there was no modern anesthesia, no sterile instruments, no understanding of bacteria, infection, or what lay beneath the bone. These are called trepanned skulls. The name comes from the Greek word for a borer, a tool for drilling holes. And they have been found across Europe, North Africa, Asia, and the Americas, in cultures with no contact with one another. Independently, on separate continents, human beings arrived at the same idea, that under the right circumstances, you could open another person's skull and they could live. Prehistoric trepanation was performed through several methods: scraping, drilling, grooving, and intersecting cuts. At Ensisheim, the marks in the bone point to a mixture of cutting and scraping, working an edge through the outer layers, then shaving the bone away by degrees rather than punching straight through. That control reduced the risk of going too deep too fast. you can still see it in the bone. The fine overlapping marks of a tool worked patiently across living skull layer by layer, the signature of patience, of repetition, of control. Hours of work with the patient awake. The sound alone would have been unforgettable. Stone scraping rhythmically against living bone while the person on the ground stayed conscious. No hospital, no anesthesia, no antiseptic. Just another human being leaning over you with a sharpened stone while your community held you still beside a fire. We don't know why it was done to this particular man. His skull shows no fracture, no disease, nothing obvious that the surgery was meant to fix. In other cases, trepanation may have followed a blow to the head, an attempt to relieve pressure after injury. Across other cases, researchers have proposed responses to trauma, pain, neurological symptoms, or ritual beliefs, though identifying the motive in any single case is often impossible. But the explanation matters less than the outcome, because even when the reasoning was wrong, the procedure was sometimes survivable. And when something works often enough that patients survive and others hear about it, communities remember. That is how knowledge passes from hand to hand before anyone can write it down. This was not a desperate improvisation. It was a technique, refined enough that the same man survived it on 2 separate occasions. And yet, for all its fame, the man at Ensisheim was not the first. For years, he was described as the oldest surgery ever found. He wasn't. Even the team that studied him suspected as much. The trepanations were so clean, so assured, that one of the researchers concluded they had been done too perfectly to be the oldest of their kind. A skill this controlled had to come from a much older tradition. He was right. It just wasn't in France. Far to the east, along the rapids of the Dnieper River in present-day Ukraine, lies a Mesolithic cemetery called Vasilyevka. It was excavated in 1953 and first reported in the 1960s, but the full significance of one particular skull would not become clear for decades. The man buried with it had also lived past the age of 50. High on the left side of his skull was a single healed opening, and the bone around it recorded his recovery in detail. The edges had closed over in distinct, stepped layers of new growth, sealing slowly while he was still alive. He had survived his surgery too, but he had done so roughly 1,000 to 2,000 years before the man at Ensisheim was even born, somewhere around 7 to 6,000 BCE. It remains the oldest healed trepanation ever recovered from the European mainland. And there are hints the practice reaches back further still. At an even older cemetery nearby, archaeologists have found more tentative traces of cranial surgery dating as early as 10,000 BCE. Fainter evidence, harder to confirm, but pointing the same direction. The record keeps moving backward. Every time we think we've found the beginning, the bones push it earlier, into a past we were taught to imagine as empty. Until now, this has been a story of individuals. One man at Ensisheim, an older man along the Dnieper. Each a single survivor, beating odds we can barely imagine. But one survivor can always be luck. Peru is where luck runs out. No place on Earth has produced more trepan skulls, more than the rest of the world combined. Hundreds upon hundreds of them from Andean cultures spanning nearly 2,000 years. In one landmark study, researchers examined more than 800 of them and lined the earliest surgeries up against the latest. What they found wasn't just survival, it was an improvement. In the earliest period, around 400 to 200 BCE, roughly 40% of patients show signs of having survived. 1,000 years later, that had climbed steeply, as high as 91% in some samples. By the height of the Inca Empire, around 1400 to 1500 CE, survival averaged between 75 and 83%. Not a perfectly smooth line, but the direction is unmistakable. Over those centuries, the surgeons were refining where they cut, how much bone they removed, and how deep they dared to go. learning, by outcome alone, which methods gave a patient the best chance to live. And they were doing it blind to the very thing that would make surgery deadly for the next 2,000 years: infection. Consider what that means. During the American Civil War, 3 centuries after the Inca, with steel instruments, trained surgeons, and a written medical tradition, nearly half of all skull surgery patients died, much of it to the infection no one yet understood. By that measure, the study's authors note, an Inca surgeon was roughly twice as likely to keep a patient alive. The comparison isn't perfect. Archaeologists aren't reading hospital charts. They're reading bone. Survival here means the skull healed enough to leave a trace, but the pattern holds. Across centuries, the wounds changed, the techniques changed, the healing improved, which means something we rarely grant the ancient world. These surgeons were getting better, generation after generation, long before anyone could explain why it worked. The methods were primitive, the thinking was not. Around 3000 BCE, medicine acquired something it had never had before: writing. In ancient Egypt, a physician recorded a collection of surgical observations unlike anything historians expected to survive from the ancient world. The document would later become known as the Edwin Smith Papyrus. The surviving copy dates to around 1600 BCE, though the observations it records are of a work from as early as 3000 BCE. Fully translated by Egyptologist James Henry Breasted in 1930, the text contains 48 medical cases written in language that feels immediately familiar to modern physicians. Not prayers, not ritual. Case studies. The physician examines injuries to the skull, neck, chest, and spine, then classifies each patient into one of 3 categories: an ailment I will treat, an ailment I will contend with, or an ailment not to be treated. That third category may be the most revealing thing in the document because it shows something recognizably clinical, an attempt to distinguish between survivable injuries and fatal ones honestly, rather than pretending every patient could be saved. The text describes skull fractures, spinal trauma, jaw injuries, and neurological symptoms with extraordinary precision. In one case, the physician notes that severe head trauma on one side of the skull can produce paralysis on the opposite side of the body. Modern physicians recognize this immediately. Today, we understand it happens because major motor pathways cross inside the brainstem. But the Egyptian physician had no such knowledge. He had simply seen it happen, again and again, until the pattern became undeniable. Another case describes a patient who cannot move their legs, has lost sensation below the waist, and has lost control of basic bodily functions. The physician records it carefully, completely, then classifies it: an ailment not to be treated, not resignation, recognition. That detail reveals something easy to miss. The physician who wrote the Edwin Smith Papyrus was not relying purely on inherited tradition. He was studying outcomes, watching patients, comparing injuries, looking for patterns, trying to predict who would recover and who would not. Not modern science yet, but the beginning of observational medicine. And perhaps the most unsettling part is that ancient physicians became skilled at diagnosing injuries they had absolutely no ability to cure. They could identify skull fractures, recognize paralysis, observe fluid leaking from the ears after catastrophic head trauma. But understanding a fatal injury is not the same as being able to save the patient, which means ancient surgeons often occupied a psychologically brutal position. They knew enough to recognize death approaching. They could not stop it. And yet they kept studying anyway. The Edwin Smith Papyrus is remarkable. But the most sophisticated surgical text from the ancient world may have come from thousands of miles away. The Sushruta Samhita, traditionally attributed to the Indian physician Sushruta around 600 BCE, describes hundreds of surgical procedures and dozens of specialized instruments in astonishing detail. When European scholars first encountered the text centuries ago, many assumed it had to be a later forgery. The procedures sounded too advanced to be ancient. They were wrong. The surviving text is a later compilation, and the date is debated, but the core procedures it preserves are unmistakably ancient. The training described in the text feels surprisingly modern. Students practicing incisions on plants before touching tissue, rehearsing suturing techniques before working on patients, and building skill through supervised repetition before operating alone. But the procedure that changed medicine was reconstructive. In ancient India, removal of the nose was used as punishment for certain crimes and social offenses. The result was not merely cosmetic disfigurement. Losing the nose could permanently alter a person's identity and place within their community. Sushruta developed a method to rebuild it. He cut a flap of skin from the cheek or forehead while leaving one edge attached to preserve blood supply. The tissue was rotated downward, shaped into a new nose, and allowed to heal in place while still connected to its original circulation. This principle, moving living tissue while maintaining its blood supply, remains one of the foundations of reconstructive surgery today. Sushruta was describing it more than 2,600 years ago. Reconstructive surgery requires a completely different mindset from emergency treatment. Saving a life after trauma is one thing. Rebuilding a face requires planning, precision, and the understanding that transplanted flesh survives only if blood continues reaching it. Even today, reconstructive surgery is considered one of the most technically demanding specialties in medicine. And Sushruta was describing it in a world without microscopes, germ theory, or modern anatomy. He also described cataract surgery. As cataracts develop, the lens of the eye gradually clouds until vision fades into near blindness. Patients watch the world slowly disappear. Sushruta described using a curved instrument to push the clouded lens out of the visual axis, partially restoring sight. The procedure was risky and did not cure the disease, but for some patients, light returned. Faces emerged from darkness. And versions of the same technique appeared independently across Egypt, Rome, India, and China. Separated by continents, physicians kept arriving at similar solutions to the same human problem. How do you give sight back to someone losing the world? They did not understand the mechanism. They found the technique anyway, because ancient practitioners often lacked scientific explanations for why a procedure worked. But through observation and repetition, they sometimes discovered techniques that modern medicine later confirmed were genuinely effective. Not because ancient medicine was magically advanced, but because human beings are extraordinarily good at learning from what survives. Everything so far. The skulls, the papyrus, the rhinoplasty, the cataract operations happened within the last 7,000 years, which now, after everything we have covered, means something. You know what surgery costs, what it demands from the surgeon, from the patient, and from the people standing around them. What a community has to believe before someone lies still beneath a stone tool. Hold that understanding and apply it to this. 31,000 years ago, a cave in Borneo, a child around 12 years old. Their lower left leg was gone. We do not know why. It may have followed an injury. It may have been an emergency response to infection or crushing trauma. It may have carried meanings we cannot recover. Archaeology can show the cut, the healing, and the burial. It cannot show the motive. The extraordinary part was not only that the leg was removed, the extraordinary part was what the bone did next. The tibia and fibula did not show the shattered pattern of an accident. They did not look like the remains of an animal attack. They bore the marks of deliberate severing by a sharp cutting tool, likely stone. And then, at the ends of the cut bones, there was healing. Smooth new growth had formed over the amputated limb. That detail changes everything, because bone does not heal on the dead. It heals only when the body stays alive long enough to begin repairing itself. The child survived the operation, not for hours, not for days, for years. The evidence suggests they lived for another 6 to 9 years after the amputation. That makes this the oldest confirmed surgical amputation ever discovered. older than metal instruments, older than written medicine, older than formal anatomy, older than hospitals. Given everything we have just covered, what that required is staggering. Whoever performed this operation had to manage catastrophic bleeding without metal instruments and without any modern understanding of circulation. They had to keep the wound from becoming fatal long enough for healing to begin. They had to help a 12-year-old survive the acute phase of an amputation, using only what their environment and accumulated knowledge could provide. The rainforest may have helped. Borneo contains extraordinary plant biodiversity, including species with medicinal properties, and the community may have carried generations of practical plant knowledge, ways to reduce pain, slow infection, or help wounds close. That knowledge would have mattered, but it does not explain what came next, because the operation was not the hardest part. Recovery was. A child who could no longer walk would have needed help. Food, water, wound care, and help moving through difficult terrain. Protection during the long period when infection, hunger, or injury could still have killed them. Archaeology cannot show us every act of care. It cannot show who carried water, who cleaned the wound, or who helped the child move. But the healed bone tells us something important. This person did not die immediately after the operation. They lived for years. And that survival strongly suggests they were not left to face recovery alone. When they finally died years later, the body was carried to the back of the cave and carefully buried. Stones were deliberately placed around the grave. Traces of red ochre were found nearby, not discarded, buried with intention. This is where the physical evidence ends and interpretation begins. We cannot say with certainty what the people who did this believed or felt, but we can say what the evidence requires. A leg was deliberately removed. The wound healed. The child survived for years, and after death, the body was treated with care. 31,000 years later, the bone still carries the record of that sequence. Not the motive, not the name of the surgeon, not the story they told themselves. Only the evidence of a cut, a healing, a survival, and a burial. This does not mean ancient people were secretly modern. They were not. Their world was unimaginably dangerous. Infection killed constantly. Pain was everywhere. Most diseases were complete mysteries, and even skilled surgeons had little power when something went seriously wrong. But that is exactly what makes the evidence powerful. The skulls from Neolithic Europe show patience and control. The Trepanations from Peru show improvement across generations. The Edwin Smith Papyrus shows physicians observing injuries, predicting outcomes, and admitting when a wound could not be treated. Sushruta's procedures show that ancient surgeons were not only trying to save lives, they were trying to restore faces, restore sight, and return people to the world they had lost. And then, behind all of that, there is the child from Borneo. A leg was removed. The bone healed. A life continued for years. That is where the history of surgery becomes something larger than technique. Not because ancient people understood the body the way we do, but because long before medicine became science, human beings were already doing something else. Something medicine still depends on. They were observing. They were learning. They were risking action when doing nothing meant watching someone suffer. The knowledge came later. The instinct came first.